Our conversation this morning with Dr. Gopala Ramineni is brought to you by Marcus & Mack, a law firm representing injured people. It's Breast Cancer Awareness Month. Dr. Ramineni is an oncologist, medical oncologist, and hematologist at IRMC's Cancer Center in partnership with UPMC Hillman Cancer Center, and it's good to have him back on the air with us again. Dr. Ramineni, good morning.
Good morning. How are you? Thank you.
Wonderful. It's good to have you back with us here today as we talk about this very serious disease. And your perspective on this is different from some of the others that we've been dealing with here during Breast Cancer Awareness Month, as you have the opportunity to, I guess maybe not opportunity, we have the opportunity to hear from you about the progression of breast cancer and how the treatment protocols work in relation to UPMC Hillman. The great thing is that everything that we could be driving to Pittsburgh to get, we now get here with you at IRMC.
So yes, thank you. It is a privilege to, as I've always told, patients give us the opportunity to take care of them, so it's a privilege that shouldn't be taken lightly. And, breast cancer is such a common disease, as I have shared in the past. 1 in 8 women have a lifetime chance of developing breast cancer, a sister we know, or mother we know, or aunt we know. Someone will have had breast cancer in their lifetime. But the good news is all of them do very well. But since it's so common, some of them unfortunately don't do well. That's where the unmet need is, and that's what the desire to make things better is. And, we want to strive every day.
And obviously, if we learn about breast cancer early enough in our lives, and we have that, it's obviously much better to learn about it early and be able to treat it early.
Yes, so I'll use the same words, nipping it in the bud. And, we have mammograms. There is no reason why, we can't have mammograms. And I'll say, there is a walk-in Wednesday, or one of the days, I'm not exactly 100% sure, but one of the days you can just walk in and get a mammogram, number one. And number two, people say, I don't have insurance, I can't get a mammogram. No, you can get a mammogram without insurance, too. And number three, mammogram is the key in detecting it early. Earlier the detection, the chances you may need chemo is less. The chances that you may have metastatic disease is less. So there is no reason why anyone shouldn't get a mammogram. And yes, we need, and also nowadays with genetic testing available, thanks to Dr. Clark, we can be even more preemptive about taking care of breast cancer patients.
Yeah, absolutely. And we'll talk with Dr. Clark later this month about just that. I wanted to talk to you about being a medical oncologist and a hematologist and what that means. The progression of any cancer through the blood is a fascinating topic for me. I'm woefully uneducated in it. Thankfully, you are not. Could you spend a few moments telling us how breast cancer moves through the body?
Sure. I'll start with hematologists and oncologists. So we do 3 years of residency and 3 years of fellowship in hematology oncology. And I finished my fellowship in 2005, too old now. And I've been practicing for almost 16 years now. Mm-hmm. And progression of breast cancer is the second question. So usually most breast cancers are cured. Stage 1, it's cured in about 92% of patients. Stage 2, it's cured in about still in the 80s. Stage 3, still in the 70s. So some of the patients, unfortunately, will recur. And this is a very inconvenient truth. And the common places of reoccurrence are bones, lung, liver, and sometimes the brain. So the first site of spread usually is the lymph node that we know of. There is more research that's being done, which we have identified circulating cancer cells even in the bloodstream of patients. And we are identifying circulating cancer cells genetic material in the blood with blood tests. So I keep telling my patients, I keep fantasizing that one day you'll go to the doctor and I'll do a blood test and say, well, I don't see any cancer cells in your blood. I don't see any cancer cell DNA in your blood, so you're clean. That day is not too far.
Wow. And of course, then comes the treatment of it. And obviously, as you said, stage 1 would be the ideal situation for having to treat breast cancer. But the treatment of breast cancer has really progressed in the last few years as well, has it not? I mean, just from year to year, you hear exciting news, and I hear it on my front as someone who's out in the general public. You who are inside this whole industry, you must really be excited by the way that the treatments are progressing.
Absolutely. Breast cancer always has set a very high standard. For example, I just mentioned, stage 1 are cured in about 92% of the patients. So that's a. It's hard to get higher than that, but, that's exactly what we want to do, because those 8 women that do relapse even with stage 1 breast cancer, when you take care of them, it's pretty difficult, pretty heartbreaking. Some of them are in their, 40s and 50s. So this is what we want to get better in. Of course, stage 1, the surgical techniques have improved, radiation techniques have improved. So we're trying to decrease the morbidity from our treatments or decrease the suffering from our treatments. And stage 4 breast cancer patients, we're trying to prolong their life. Not uncommonly, we have patients living into 10 years and living into 5, 6 years, even with stage 4 breast cancer. Unlike before, thanks to improvements in targeted treatments. What is a targeted treatment? Targeted treatment is when a cancer cell has a defect, we know that normal cells don't. We can attack it, So one of the best examples is there is a drug called olaparib, which is a PARP inhibitor, which specifically targets the weakness in the cancer cells, if you will. That's one area of rapid development. And the second area of rapid development is immunotherapy. So triple-negative breast cancers, not all of them, some of them can now get a type of immunotherapy. And actually, I'm very happy to have a patient who had stage 4 breast cancer with triple-negative breast cancer. Thanks to immunotherapy, she remains cured and no evidence of disease for the last 2 years. I wish I have those stories all the time, but it's a step in the right direction.
Dr. Gopala Ramineni with us this morning, and he's with IRMC at the Cancer Center in partnership with UPMC Hillman Cancer Center. I want to talk about that for just a moment. We can very easily say that all of the services available through UPMC Hillman are available here at IRMC. You don't have to go to Pittsburgh to get it. But what does that really mean? What is the advantage that UPMC Hillman Cancer Center coming here to Indiana gives to patients?
So I will say that, I think we've got a great group of colleagues. Say, for example, I have a patient that I have a very difficult question, not a common situation. I can pick up the phone, I can call my colleagues who only do breast cancer in their lifetime, and I can pick up and call my colleague who only does, prostate cancer for that matter, and I can take their expert help, number one. Number two, we have what's called as pathways. The pathways help steer all the physicians in some sort of a protocol or some sort of a guideline-driven treatment. And number three is we have the access to clinical trials that are available through the cancer center. So the partnership is very, very viable for patient care and very, very useful for patient care where they don't have to drive to Pittsburgh.
Mm-hmm.
I sometimes jokingly say, you don't need to drive to Shadyside to eat the same Burger King. You can get it in Indiana.
That's a great point. And it really drives home the point of the advantage of the UPMC Hillman Cancer Center at IRMC. That's a great one. Dr. Ramineni, of course, when you have that diagnosis of breast cancer, that's such a scary thing, and we know that it can knock you down for a little bit. IRMC, of course, with its Nurse Navigator program, with the way that you are guided through the system of treatment, it's such a great advantage, and they may just end up coming to see you at some point and your colleagues, and it's so good to know that you are here, that the Cancer Center is doing what it's doing, and breast cancer awareness is such an important topic for this month. Just before we let you go, I want to give you one last chance to really stress that point about the mammograms. It's so important, isn't it?
Absolutely. I mean, I would like to see everybody in stage 1. If if those wonderful women hearing this, if you get diagnosed in stage 1, there is a very good chance you may not need chemo. There is a very good chance, you may get a limited amount of surgery, very limited amount of radiation. So it's much easier to take care of things. Stitch in time saves 9. So good old adage. So mammograms are so useful in this regard. And as I said, you don't need to have insurance. I'm sure, and I will have IRMC back this up, and they do, number one. And number two, you don't need an appointment. There is one day a week, I think it's Walk-in Wednesday. You can just walk in and get your mammogram. So please, there is no reason why I should see a stage 2 or a stage 3 or stage 4 patient.
Yeah, absolutely. He is Dr. Gopala Ramineni joining us here this morning on Indiana in the Morning. Get your mammogram, ladies. Just call the hospital and say, I need a mammogram, and they'll take you through the whole system from there. Dr. Ramineni, thank you so much for being with us today. Appreciate it.
Thank you so much. Have a good day.
You too. You too.